So first question here, we know that in the Tampa Bay area, we are seeing a surge in cases, especially among young people. Many of these people, they are probably parents. Are you seeing more cases in kids at this point?
Actually, we have started seeing more patients in kids very recently. As of last week, a third of all the patients we'd seen since the beginning of the pandemic were recorded in the last week.
Wow.
So yeah, that's a huge increase in the frequency of positive tests in kids who've presented here.
Obviously, that's concerning for doctors. Are the symptoms mild or are they more severe?
Most of the children who present here and test positive for COVID-19 have relatively mild symptoms. Some have had no symptoms at all, and they were just picked up because we're now screening all children who come in for surgery. Some had very mild symptoms and were sent home from the emergency room. So very few, fortunately, have had severe symptoms. Now, when children do get sick, they seem to have a variety of symptoms. They tend not to have as many symptoms or as severe symptoms as adults. But the symptoms that children can have may include some fevers that may be low grade or occasionally very high. They may just be irritable. They often complain of being achy. They may have cough and congestion, but they don't have to have that. Their appetite may be decreased and they may be a little more lethargic than usual.
You know, but with kids, if we think that they potentially were exposed or someone in the household, should we go to the pediatrician's office? Obviously not the ER to go get screened for just COVID, unless there was another issue. Should we go to the doctor to get them screened or to an urgent care clinic?
So if your child is starting to get sick and you're interested in having them tested for COVID-19, I think that the first step is to call your pediatrician's office and ask them what they advise. Some offices may be doing testing, and that's going to be the most convenient, best way for you to get it done if the child's nurse or pediatrician at the pediatrician's office can do the testing for you. If they are not doing the testing there, they will have some recommendations locally in the town or community where the office is located about where you can go to get tested. And I think that's going to be the best advice, because there's not going to be like one location for all of Tampa, one location for all of Pinellas County. In some cases, in certain communities, the emergency department may be the best choice.
Mm-hmm.
But the pediatrician should know that.
And are you surprised when you say 1/3 of the patients you've seen with COVID just in the last, what you said, month or week?
Week.
Yeah, last week. Are you surprised by that? I mean, that's...
Oh, I'm not surprised, but I'm extremely concerned. It is reflecting the numbers that we're seeing across the state of Florida that have been rising daily over the last week and a half. And so I am very concerned that we are losing the reins on this horse, and that we may lose control of this pandemic locally, and that it may even force us to start shutting things down again. I really hope that that doesn't happen, though.
What can we do as families to help you all, as physicians, as hospitals, to not overwhelm you?
We don't have great treatments for COVID-19 if you're not sick enough to be in the hospital. So the best thing to prevent overwhelming the doctors and the hospitals is to not get infected in the first place. So prevention is number one. And prevention is best done by avoiding contact unnecessarily with other people. If it's necessary, though, try to do it as safely as possible. Now, one of the big concerns and risks for being exposed to other people in the summer are summer camp and daycare. And with more people going back to work, someone needs to take care of their kids. And unfortunately, a lot of people do not have a family member who can care for their kids when they're going back to work. What summer camps and daycares have been trying to do as much as possible, and what you want to look for in what may be a safer type of summer camp or daycare, is where they've broken up the children into smaller groups, smaller classes, so that if COVID-19 does get introduced into that summer camp, it will affect a smaller group of the kids and not everybody in that camp. Ideally, the groups should not be interacting with each other. Those groups just stay together all day, every day, with minimal interactions with the other groups. They shouldn't be having lunch together in one big dining hall like they usually would any other summer. Instead, they're going to have lunch only with their individual group. And so you can ask about that when assigning up your child for summer care, for summer camp or daycare, to see, are they doing some of these things that are recommended to minimize the chance of your child being exposed to COVID-19 in that group setting. Also, the more outdoor activities they have, the better, because it's probably harder to spread it outdoors than indoors. But our weather doesn't always allow extensive outdoor activities.
Are you surprised to see how quickly that this virus has spread in our community since we reopened?
No, I am not surprised at how quickly the virus has spread. I think that, well, I know that and I think that most infectious disease doctors who have been following this expected this to happen. And in fact, Dr. Fauci's been saying this for a few months now, that the reason that we were closing things down was to decrease the spread of the virus with a primary goal of not allowing the hospitals to get overwhelmed. And we succeeded in doing that across most of the country, except some places like New York City. Because things started to open up, and I'm not saying that they shouldn't have opened up, because things started to open up, unfortunately, some people started to also think that the pandemic was over or ending soon. And they were completely relaxing their practicing of precautions in a way to increase rapid transmission of this virus. And this is a relatively easy virus to spread.
And let's talk about ways we can continue to protect ourselves. And we know we've talked about that hand sanitizer, washing hands, not going out when you're sick, but we're coming up on a big weekend with July 4th. What can we do with some of that summer traveling that people are probably, despite warnings, are still going to do anyway?
Right. It is still possible to travel safely and avoid getting infected. Your risk when traveling basically depends upon how many people are you going to be exposed to. And are you going to get close to many people in crowded situations, or are you going to be relatively isolated from people most of the time? If your vacation entails going to a theme park like Disney World or Universal in Orlando, any theme park, that will entail being in lines, being in crowds, being in restaurants, compared to staying in an isolated cabin in the mountains, where you've stocked up on groceries on the first day of your trip, and you're going to eat in most of the week. You can schedule your daily activities to minimize exposure to other people who might be contagious with the virus and be relatively safe. If you want to go to a beach, some beaches are crowded and some are not. The less crowded beach is inherently safer than the more crowded one. If you're going to travel by plane, that's going to entail much more exposure to larger numbers of people than traveling by car. And so your relative risk all depends upon how much you can isolate yourself from the other people that might be shedding the virus, and you can't tell just by looking at them.
So that's why we just have to wear those face masks when we go out and wash our hands, right?
Right. the very healthy person that you're chatting with in line at the grocery store could be blowing virus right into your face if they are not wearing a mask and you are not wearing a mask.
And I know we have, especially, here in Tampa, if you're inside of a building, you do have to have a mask on. I'm sure we'll see more of those orders coming about in the rest of the area. But people are apparently still violating that rule. What is your message to those people who are still going out indoors and not wearing a mask? What would you say to people who are like, I'm not going to wear a mask, it's not going to work?
I think I would say three things. One is the pandemic is not over, and it is starting to get worse in the Tampa Bay area. Number two is that you need to protect yourself and the people around you, including your coworkers and family members and the people you love, by not getting infected.
Mm-hmm.
The third is that when you leave your home, your attitude should not be, what can I get away with doing and not get into trouble? And therefore, if one place makes me wear a mask, I'll wear the mask, but if the other place doesn't make me wear a mask, I won't wear a mask. Instead, the attitude one should have when leaving your home is, I need to protect myself and the people around me, so I am going to wear a mask when I have to be closer than 6 feet to other people.
Very good advice. I know we already went over the summer traveling. One big thing is with kids having to wear a mask. I've had this battle with my 4-year-old, especially my 7-year-old. First of all, it's getting them to wear it. Number two, making sure that they don't touch it and fiddle with it all the time. Any advice that you have for parents? I know it's hard when they're little, but
yeah,
what are you telling them?
It's very challenging to have a young child keep on a mask, and it's even recommended by the American Academy of Pediatrics to not even try putting a mask on a child under 2 years of age. And we don't want to put masks on children with underlying respiratory problems who have trouble breathing on their own or on a ventilator. So what we would recommend for younger children is that you not put them in the situation where they should wear a mask. So don't put them into crowded situations. If they're with a group of people, it's just family members, or sometimes they'll want to schedule a play date with another child in their family. That should only be done with other families who are also practicing the same precautions and social distancing that you are. Other families that are not engaging in those precautions and social distancing, you should not have play dates with them, because that entails more risk of introducing virus into your household.
Remember when we were kids, parents would make us go hug our friends with chicken pox. What would you say to people who are saying that? Like, let's just go get it out, herd immunity. Let's just get it over with. What are your thoughts on that?
Okay. If your solution to the pandemic is to let people get infected quickly so that herd immunity rises to a level to slow down the pandemic, you're accepting the deaths of thousands more people than would otherwise have to die in the state of Florida, and millions of people in the United States. So it's a bit of a callous solution to the pandemic. And that's why it's not being recommended by most public health experts.
It's just a respect for our fellow neighbors is what it comes down to, right?
It does, and for those people who are religious, and most of the major religions do encourage respect for fellow neighbors. Mm-hmm. Those who are not respecting their neighbors are not adhering to the tenets of that religion.
Anything else I didn't ask that you want to add that you've been seeing coming into the hospital, what you've seen locally? I know the last week, like you said, a lot has changed. I anticipate probably a lot more change another week from now. But
one thing I would say is, do not listen to the people who've been saying that the numbers of COVID-19 rising in Florida are only due to increased testing. That is completely false.